Hello, my name is Dr. Gill from Park Court Medical Clinic, and today we're going to be demonstrating dermal fillers. Let's first talk a little bit about ageing skin. Skin ages for many different reasons, not just age, but the sun exposure over the years, hormonal changes, for example in this case the menopause, but also stress and lifestyles that we lead. So often when we think about ageing, what do we think about the skin? We think about the complexion becoming slightly more dull, the texture becoming a little bit more uneven. We start seeing the development of some fine lines and also some wrinkles which develop around the face area. We also notice that the face volume starts to drop from the top parts around the cheeks to the bottom parts around the jaw area. So dermal fillers are a way of reintroducing the hyaluronic acid, which often is depleted as we age. Ageing is not just about collagen becoming less effective in its production, but also the hyaluronic acid, which is the water holding capacity of our skin, starts to become depleted. So dermal fillers are a very natural way of introducing what really is already present in the skin, but in less numbers. It's a very natural product, it has got no testing on animals, and it really just fills the line instantly. It can last almost 6 to 12 months depending on the depth of the lines and also just the lifestyle that we lead and the amount of sun exposure that we are exposing ourselves to. If I just quickly have a little talk about where we see lines and where we use dermal fillers. Dermal fillers are particularly very effective along the nose to mouth lines, which are these lines across here. There are also lines called marionette lines, which is often the sadness that we develop as we age, and these can be filled here. We also have these very fine lines around the glabella area, around the lips area, also defining lips. All dermal fillers are fantastic for these indications. Every patient is different and all the products are different, and we have to really gauge what the patient requires and the depth of the line that needs to be treated, so every patient is treated individually. Today we're going to be doing a treatment on the nose to mouth lines, which are these folds which run along the side of the face. We're going to be using a product called Juvederm. Juvederm is a very effective, very safe and a very long-lasting product. And here at Park Court we believe that safety is very important, but also producing the best results that we can possibly produce. So we're going to be using a Juvederm 4 because the lines are quite deep, and this is one of the thicker products on the market. For very fine lines there will be thinner products, and in certain other areas depth of lines we can use the grade of product which is specific for that patient. Today we're going to be using 4, which is because the lines are quite deep. Okay, so this is the product in the syringe. And we will just be travelling up the line. Like so. How are you feeling? Right. We then complete the other side and then see where we need to touch up to make sure that we can get as much good results as possible. The face is never symmetrical, so we're not looking for symmetry. However, we're just looking for a natural look and natural finish. We've just finished the procedure for the nasolabial lines. It's taken us almost about 15-20 minutes. If you have a look, there's very little redness of the area. The post-care now for the patient, would be to make sure that they don't go into any hot steam rooms or saunas or showers, and also not to expose themselves significantly to the sun. We will apply some sun protection factor to ensure that the patient is well protected before they leave the clinic. Now the product should hopefully last for almost 6, 9 or 12 months, again depending on the lifestyle of the patient. I'm going to sit you up. Have a quick look at the area. You can just see the softening of the lines. Now after the treatment, because of the hyaluronic nature, it actually absorbs more water. So over the next few days and weeks you'll see that the lines will actually improve even more than they are now. So although there's an instant effect, the results will be even better in the next few weeks. The most rewarding part of the treatment is then showing the patient how much of a difference it actually has made. So I'm going to now show you what it looks like. Have a quick look, sit up for me.
Wow, it says amazing. It was so nice. Much better. Much
How does that make you feel?
Oh, it feels much better. It looks so young.
Yeah, that's what we like to hear.
Yeah,
very nice.
Very nice.
So that's treatment for dermal fillers, for nasolabial lines, and thank you very much for watching.